Hi, I'm Dr. Shilpa GB from Bangalore. I'm a consultant obstetrician, gynecologist, and infertility specialist. So, today we'll talk about what is high risk pregnancy. High risk pregnancy is a pregnancy in which the management or the treatment is changed because of certain factors in the pregnancy. So, this could be a pregnancy where it is complicated with diabetes, increased blood pressure, thyroid disorders, multiple pregnancies like twins or triplets, or it could be an IVF pregnancy. So, in these situations, why are we worried? We are worried because we want the best of the outcomes for the mother and for the baby. So, how is it different from a normal pregnancy? So, here in terms of like managing the pregnancy, the things are different, and also the mode of delivery is also a little different than how we deal with a low risk pregnancy. So in high risk pregnancy, what all happens? So the normal intervals of antenatal care visits to your doctor, which according to the government of India is up till 28 weeks, it is once in a month. 28 to 36 weeks, it is once in 15 days, and after 36 weeks of pregnancy, it is once in a week till you deliver. It is slightly more frequent, and it depends on what kind of problems you are facing during pregnancy, and also what extra medications or extra treatment needs to be given for in your case specifically. So it is a very individualized approach. Here doing an ultrasound may be more frequent, especially in cases of twins and in IVF pregnancies. We may have to do more and more number of scans in the first trimester to check if everything is okay, like especially in cases where there is slight bleeding in the first trimester, or when there is clot which is seen in the ultrasound scan. So to monitor all that, we may have to do more frequent scans. And if it is a pregnancy which is complicated with diabetes mellitus, then we will have to do more and more scans to check for the growth of the baby after 28 weeks onwards as to more frequently. So if we do a scan probably once at 32 weeks and once at 37 weeks, here we do it once in 3 weeks to check whether the diabetes and the increased sugars is affecting the growth of the baby. So similarly, in other situations like in twins, where it is not possible for us to assess that the growth of both the babies are happening at par or equally. So at those times, we need to go for ultrasound scans, which will help us determine as to how each baby's growth is. Also, in cases where we are suspecting that the patient may go in for increased blood pressure, or if at all, if we are suspecting that this patient may go in for premature delivery. So there are certain tests that we would like them to do so that we are cautious, and we also can counsel them about what is the expected outcome. So in these situations, like we tell them to do the blood test more frequently, that is to diagnose if at all if there is anemia, that is reduced hemoglobin. So this we usually do it once in 6 weeks, but in cases where we suspect that there could be a problem, we can do it more frequently. In cases where we are suspecting diabetes, we do the sugar test probably every month, and in case where there is a previous history of premature delivery, then we do tests like urine routine and urine culture to detect if at all if there is any urinary tract infection which can trigger the labor pains. And in case if we are suspecting premature delivery, or in case if we expect that the cervix may be short, which will be identified at 16 to 20 weeks, and if we are counseling the patient that she may have to deliver prematurely, or there is a possibility like that, then we tell them to deliver in a place where there is a facility for an ICU. And apart from all these things, so the major thing is like one is the blood test, urine test, and the scanning. So apart from all this, we check mainly about how much weight gain they are having at every visit, what is their blood pressure at every visit, and based on all this, we determine the mode of delivery. So there are other factors like one, anemia, which is a very common condition in India, where it is because of the iron deficiency status, and in these cases we supplement them with iron tablets, and if that is not sufficient, we give them iron injections. And the second commonest problem that we face in India is the increase in the blood pressure. So increase in the blood pressure definitely again needs medications, that is the antihypertensives during pregnancy, which are supposed to be safe both for the mother and for the baby. So diabetes is again managed as in like giving them oral anti-diabetic agents and also insulin and strict monitoring of the sugars. Twins, again, the chances of premature delivery will be more. We tell them to probably be prepared to deliver in a place where there is an NICU setup. In case if required, we will organize for the blood to be reserved during the time of delivery in case if the patient is anemic, if she has low implanted placenta, if at all, if we expect in case of twins, if we expect that blood loss is going to be more during delivery. So in all these cases, our threshold to do a cesarean will be low because we want both the mother and the baby to be fine. And coming to the fetal factors, if the baby is becoming more and more heavier, then also it is a problem. Then also it becomes a high risk because during delivery there will be a problem called shoulder dystocia, which we should be able to manage if at all if the patient delivers vaginally. If the baby is not growing well, which is called a intrauterine growth retardation, then also it is a problem where the baby is not able to go through the process of labor, that is the normal delivery, and we may have to do a cesarean. So another important factor which is becoming more and more common nowadays is the obesity, that is the mother being on the heavier side or putting on a lot of weight during pregnancy, which may not be really good. It doesn't mean that putting on more weight and baby becoming more big is the healthier version. So in such cases also, I think it is classified as high risk pregnancy and it will definitely need individualized care. So in any of these conditions, if you are facing it, then it is better to consult your healthcare professional, your doctor. And if at all, if you have any doubts, please feel free to comment. I will be happy to answer. Thank you.